I'm Esther Cohen. I'm a pediatrician at BMC. I also do pediatric rheumatology. I take care of kids primarily in an urban setting, and I at firsthand see a lot of the impact that environmental policies have on kids' health. Gas and diesel vehicles have a lot of negative impacts, and those impacts disproportionately affect um, children and the elderly, as you might expect. So when you burn diesel and gasoline, it generates very fine particles. They're all different sizes, but they're classified into the ones that have the biggest health impacts are classified into particulate matter 2.5 and ultrafine particles. And you can see that basically, depending on the dimensions of the particle, they penetrate more deeply into the lungs. Um, this is sort of logical. The lungs get smaller and smaller as they branch. And the reason they get smaller and smaller is so that the air sacs, the alveoli at the very end are interfacing with tiny little blood vessels called capillaries so that they can seamlessly transfer oxygen and carbon dioxide into our blood. So very fine particles you've heard probably have problems with or may have with talc and silica and other things that are very fine can cause the biggest problems. And these combustion particles can reach all the way into the air sacs, which are absolutely crucial for exchanging um, oxygen and carbon dioxide in the lungs. We know for sure that these products can make asthma worse in kids, and certainly there's a much higher rate of asthma in urban environments. I'm not an expert in asthma, but that is probably due to a lot of reasons. But one big part of it is probably the proximity to traffic and pollution and things like that. And we know in the elderly, in a condition called COPD, which has some similarities to asthma, that also can get worse. And then likewise, the kind of chronic inflammation that's caused by exposure to this particulate matter can increase the risk of infections. So there are other products of gas and diesel combustion that are problematic. Nitrogen oxides are a pollutant that is linked to worsened lung function in a lot of large epidemiologic studies. Polycyclic aromatic hydrocarbons. I don't know if you guys have ever been told not to eat bread that's extremely burned, but that those are present in anything that's been really combusted, kind of to the end point of combustion. And this might be going a little deeper than people are interested, but basically, DNA is stacked like this, and these molecules are also kind of flat stacks or flat shapes, and they can go in between DNA. And then when your body goes around and tries to replicate the DNA like it's doing all the time, it will make an error because you have something sticking out of it that is making the DNA look like it's a different shape. And as a result of that, you get mutations, and most of the time your body repairs those mutations, and sometimes it doesn't, and sometimes those mutations lead to cancer. So that's a very obvious progression that you can literally see what it's doing in the DNA and how it causes a clinical disease. Um, kids concentrate a lot of these things in their body more so than adults because they're developing, so they're internalizing a lot more into their body that's required for growth. They don't have the same defense mechanisms. They take more air per pound. Um, Both of these compounds have been associated with similar things as before, preterm birth in pregnant moms, a lot of neurodevelopmental disorders and cancers, as I mentioned above, and elderly for slightly different reasons, but also because of their defense mechanisms also at high risk for exposure to both these things. Yeah. So basically, the best remedies are, I mean, there are a lot of potential remedies, but basically anything that reduces the concentration of these things in the air. So basically, um, regulating the air concentrations of the nitrogen oxides and the particulate matter. Um, Greening, meaning a lot, our trees and vegetation do a lot to clean the air, not just processing greenhouse gases, but doing a lot with particulate matter as well. Filters at school so that even if the outside environment has a lot of this particulate matter. They're just getting less exposure sort of per minute per day. Um, we've all gotten alerts on our phones when the air quality is poor to stay indoors. Um, and just zoning policies so that roads are right and not right next to places where people live, highways, schools. And then, of course, the most obvious, which is at the top, is transitioning to cleaner technologies. And those are electric and also the ultra low sulfur diesel is mentioned for trucks and other things.